This presentation is on knee osteoarthritis. So typical epidemiological data is that it happens more in older adults, females greater than males, higher prevalence in African American men over Caucasian men due to repetitive joint use, so like squatting, prolonged standing, and kneeling. Higher prevalence in obese individuals, individuals with high bone mineral density. There is a genetic component. Low vitamin D levels, if the patient has knee malalignment, and if there's a post-traumatic injury, there's also a high incidence of knee osteoarthritis. So subjective data, the patients usually describe it as achy stiffness in the joint. They're going to complain of morning stiffness, and the pain will fluctuate with increases of pain with activity. The video is going to be a case example of a 6-year-old male with knee pain.
Hi, Mr. Smith. How are you doing today?
Good, how are you?
I'm good. So what brings you into physical therapy today?
I've been having a lot of knee pain, specifically on my right side. I've been noticing, and it's starting to kind of really get in the way of my life and my day-to-day activities and job and everything.
I'm sorry to hear that. Was there anything that happened specifically? Like, did you injure yourself when that started happening?
No, it's been going on for a while, and there wasn't like one specifically incident or anything that started to cause this issue to come on. So it's just been slowly progressing, and it's just now gotten to the point where it's just really interfering with my life.
So how long has this been happening for, would you say?
For like at least half a year, I can say for sure. Maybe a little bit longer than that. Maybe
And
like
it's just been
8
slowly
months.
been getting worse?
Yeah.
So have you ever had any like other like previous injuries to your knee?
I mean, like I guess so. Yeah, technically, yeah. What was it? Geez. Let's see, going all the way back 1976 or so.
That's very
Yeah.
specific.
Yeah, well, I mean,
1976.
it was
What
a pretty.
happened?
I
What
was
happened then?
playing basketball and I injured it then pretty bad. So, but it managed to heal over time. And,
Gotcha. But that was a long time ago. But now.
yeah, so that's why I was just like, should I even bother saying? Because it was so long ago.
It's good to know. It's good to know these
Okay.
things. So what typically makes your pain worse?
Well, I guess like when I'm working, because I do plumbing for a
Okay.
living. So when I'm working, it tends to really come on, and I notice it then, and it really gets in the way of my job. You know, where I've actually had to kind of call it quits a little earlier in the day than I normally would. Yeah.
What do you typically do? Like, what's a normal day look like for you when you're plumbing?
Oh my gosh. So well, lots of handy work. I'm on my feet all day long, either on my feet or on my knees. I don't know if that directly has anything to do with it, but I'm walking, I'm standing, I'm kneeling, squatting, lunging. Yeah, just
So a lot of like
everything.
lower
Yeah.
body movements. Gotcha.
Yeah.
So how would you describe the pain?
It's like a combination of like stiffness and then a bit of achiness as well.
Okay.
Yeah, it's kind of hard to describe, but that's like the best way I could describe it.
Gotcha. So I know you said that working a lot brings on the pain. Do you ever notice like a time of day where it bothers you more so than the other time of day?
So, yeah, when I wake up in the morning, it tends like it's usually not achy, but just really stiff.
Okay.
But then once I start moving around, that stiffness kind of goes away, and then like let's say I have to work that day. When I'm working throughout the day, that achy pain starts to come on, and it starts to just kind of ramp up and gets worse and worse as the day goes on.
Gotcha.
Yeah.
Okay. So it kind of fluctuates throughout the day. Gotcha. How would you describe your pain on a scale of 0 to 10? 0 is no pain, 10 is like you need to go to the ER. How would you describe it right now?
Right now, it's like a 5 or 6.
Okay.
So yeah.
And then what's the best it'll get to? Does it ever get to a 0?
I wish. No. The best I'd say probably a 2. Yeah.
A 2? Okay. And then at its worst, what would you say?
At its worst, like the most recent I can remember of it being at its worst was like an 8.
Okay.
Yeah.
So it gets pretty high up there.
Yeah. Yeah, it does. That on that day in particular, like I had to just stop and call it a day for my job. And
you were working a lot that day?
Oh yeah, and I had to just tell my boss and tell the people I was working for, I had to go home, so I couldn't handle it anymore. So yeah.
Gotcha. Is there anything in your medical history that I should be aware of?
I guess like the last time I was at the doctor, not too long ago actually, they did tell me that I do have like a slight vitamin D deficiency, which I had no idea. And then also I do suffer apparently from obesity, and my doctor did tell me just straight up, very professional, just told me it would be obviously in my best interest if I just lost a little bit of weight as well.
Gotcha. Yeah. Is there any like family history of anything I should be aware of?
Well, my father is obese, and my mother suffers from like high blood pressure, high cholesterol, and then also she also has osteoarthritis.
Okay, good to know. Good to know.
Yeah.
So I just want to ask a couple questions just to rule out. We like to ask these to all patients. So I just want to find out if you're having like any sort of like night pain or pain that keeps you up at night. No? Okay. Any like bowel or bladder issues?
No.
No. Any fever?
No.
Any unexpected weight gain or weight loss?
No.
Okay. Alright, just wanted to run through that and clear that out. So that's good for the question portion. Now we're going to move on to the objective portion of the exam.
Okay, that sounds good. Yeah.
Hi, Mr.
For objective findings, typically patients will present with swelling, they'll have some strength deficits, they can also have range of motion impairments. Like previously stated, they can have knee malalignment, which will create greater pressure on one aspect of the knee. And then on the Kellegren and Lawrence grading scale, which is a scale for classifying the severity of OA, they'll either have 2 or greater. And it's important to note that higher scores do correlate with lower pain sensitivity, while lower grade scores correlate with higher pain sensitivity. So this is the objective portion of the exam.
Okay, so next we're going to move on to our objective exam. So I just want to get a sense of how you're moving. So I just want you to do just a normal squat, and I'm just going to see how it looks. So go ahead.
Okay.
Okay, and then are you able to do it from the side? So turn to the side.
Okay.
Just want to see every angle. Awesome, thank you. And then one from the back.
So face this one?
Yep. And then let's see. Good. I have you lay on here.
Okay.
And I'm just going to get some range of motion. So it's on your right leg. So first I'm going to look at your left leg. So straighten it up as much as you can. Good. So you're able to get to 0. Now I'm going to bend it. Let's see how much you're able to bend it.
Okay.
And bend it like you can. Good. That looks within normal limits. Now we're going to look at this side. So you can put this leg down. And I want to see how much you're able to straighten that leg.
Okay.
Okay. So you're not able to get more straight than that.
Mm-hmm.
Okay, so I see you're lacking a couple of degrees. And then I want to see you bend this leg as much as you can.
Sometimes I gotta go a little slow.
Gotcha, yeah. So you're not able to go as much. And I do notice that you do have some swelling in this knee compared to the other one.
Yeah,
just a little note.
I know. I try and ice it, but it's, yeah.
No
It
worries.
only does so much.
So those are the only range of motion that I want to look at. Now I'm going to look at a little bit of your strength. So you're able to sit up. You don't have to lay down for these ones. Okay. So I'm going to do the left side first, and then we'll look at the right side.
Okay.
So go ahead and lift this leg up. So
Straight up?
Yep.
Okay.
I'm going to pitch down and like move you. Awesome. Good. Next one I'm going to do, are you able to straighten this leg out for me? Good. Unbend it a little bit. Okay, so let me move you. Awesome. Next one, I'm going to try to pull you out and let me move you. Good. Okay. Now we're going to do this side. So bring the knee up.
Okay.
Yep. Okay, so So this one's a little weaker, but no worries, nothing we can't work on. Straighten this out for me. Awesome. I'm going to try to push you down. And then maybe, okay, so this one's straighten a little bit. And then try to push out. Same thing. So overall, it just seems like this adds a little bit more stronger. Next thing that we are going to look at is, I just want you to lay on your side. I just want to look at your hip strength. Here. So you can lay on your, you want to look at your left side first, so lay on your right.
Okay, gotcha.
Just going to look at hip strength, so go ahead, lift your leg up. I'm going to push down, move you. Really, really strong. Now, the other way. Just a little bit in the other. So that's good for the objective examination. So from what I've seen, it seems like you might have some OA in your knee, so that is definitely something that we can see. So next one.
So the key diagnostic feature, you can only really see it through imaging. So as you can see in this picture, there's just joint space narrowing. The mechanism of symptoms, they are nociceptive and neuropathic in nature. It is damage to the articular cartilage / the bone, which leads to inflammation and release of the inflammatory cytokines, which accelerates cartilage degeneration. The release of these inflammatory mediators and formation of the osteophytes can irritate sensory nerve endings, which cause the pain. And you will be able to treat this population.